Welcome to this explainer. Today we're unraveling a truly fascinating medical mystery. We're looking at a condition that literally turns the entire world upside down. And we're going to solve this mystery together by digging into the visual evidence we have lined up. The condition we're talking about is called Benign Paroxysmal Positional Vertigo, or BPV for short, and it's all about a secret code hidden deep inside the human ear.
Okay, let's dive into this. Here's our roadmap for today. We'll start with the mystery of vertigo itself. Then meet the medical detective whose research we're exploring, and look at the difference between floating and stuck debris in the ear. From there, we get to the really exciting part, learning how to read the secret code of eye movements, mapping out the ear canals, and finally, exploring how doctors restore your balance. We're going to trace these terrifying symptoms right back to their exact microscopic source.
Section 1. The Mystery of Vertigo. To really grasp this, we first have to understand just how unsettling vestibular disorders truly are. Have you ever felt like the room was just completely spinning out of control just by turning your head slightly? Imagine that for a second. That terrifying, intense spinning sensation. It is incredibly disorienting. And what's absolutely mind-blowing here is that our entire reality, our sense of gravity, our balance, our spatial awareness, it's all dictated by these tiny microscopic organs tucked away deep inside our inner ear. When they misfire, our perception of reality just completely spins out of control. And that brings us to the formal definition of, our crime scene for this explainer, benign paroxysmal positional vertigo, or BPPV. This is a specific condition that originates right from the otolithic organs in the vestibular portion of the inner ear, and it results in severe positional vertigo. Put simply, this isn't just some vague, hard-to-pin-down illness. It's a very specific mechanical failure inside the inner ear's delicate plumbing. Section 2. Meet the medical detective. Now, every great mystery needs a lead investigator, right? Our guide today is Dr. Ali Danesh. He's a professor at Florida Atlantic University, and he holds secondary appointments that bridge biomedical science, psychology, and engineering. The guy is a highly respected expert in areas like tinnitus, hyperacusis, misophonia, and vestibular assessment. Plus, he's a distinguished fellow of the American Academy of Audiology. Basically, his detailed research criteria form the absolute foundation of what we're decoding today. He is the ultimate authority when it comes to figuring out exactly what goes wrong when our inner ears fail us. Section 3. Floating versus stuck debris. Okay, so let's transition into the actual mechanics of the inner ear, because it turns out the culprits behind BPPV are these rogue microscopic rocks called otoliths that have essentially escaped into parts of the ear where they literally do not belong. And this brilliantly illustrates the two main ways these little rocks cause total chaos. First up, we have canalithiasis. This is free-floating, loose debris moving right through the ear canal. Think of it like a shaken snow globe. The particles just swirl around and trigger symptoms based on how you tilt your head. Then, on the other hand, we have cupulolithiasis. This is when the debris gets physically stuck to the ear's delicate sensory organ, the cupula. Imagine taking a piece of chewing gum and sticking it directly onto a hypersensitive motion sensor. It weighs the whole thing down and causes persistent, ongoing symptoms that just won't quit. Section 4. Nystagmus, the secret code. So, you're probably wondering, if these rocks are locked away deep inside the skull, how on earth do doctors actually know where they are? Well, it turns out the body leaves behind some incredibly specific visual clues. The answer is nystagmus. This refers to specific involuntary eye twitches. But don't just think of this as a regular clinical symptom. I want you to think of nystagmus as a diagnostic alarm system. It's literally a secret code being broadcast directly through the patient's eyes, telling the doctor exactly which ear canal contains that rogue debris. It's amazing. So the crucial point is what we call the fast phase of that eye twitch. You see, nystagmus usually involves a slow drift of the eye in one direction, followed by a rapid corrective jerk, and that jerk is the fast phase. According to Dr. Danesh's clinical criteria, the direction of that fast phase usually points directly toward the affected side. The eyes are literally pointing right at the problem. Section 5. Mapping the ear canals. Now, we're going to use Dr. Danesh's specific diagnostic criteria to map out the clues for each and every canal. Honestly, this is like a masterclass in medical deduction. If the debris is hanging out in the posterior canal, the doctor is going to see a torsional or twisting, upbeating eye twitch, and the fast phase will point right to the affected side. Now, if it's in the horizontal canal, the eye movement is horizontal and geotropic, which just means it beats directly toward the earth or the ground. And if it's the anterior canal, the eyes will show a downbeating or twisting twitch, with the top part of the eye directed toward the affected side. It's like the eyes are performing this perfectly mapped dance that corresponds precisely to the inner ear's anatomy. Now, what's really interesting about this slide is what happens when things get a bit more complicated, because, not every single case follows the standard rules. For instance, if debris is in the short arm of the posterior canal, you might see an atypical downbeating twitch that actually points away from the involved side. Or in the horizontal canal, you might catch an apogeotropic twitch, meaning it beats away from the ground because the debris is lodged right near a specific area called the ampulla. But the absolute most vital clue happens if the debris is stuck, that cupulolithiasis we were talking about earlier. When the debris is stuck, the eye-twitching code becomes persistent. It lasts for well over 60 seconds without fatiguing or slowing down. That duration is the dead giveaway, telling the doctor the debris isn't just freely floating, it is stuck fast. Section 6. Restoring your balance. So all of this totally fascinating diagnostic detective work leads to one ultimate goal: vestibular rehabilitation and finally getting the patient their life back. By correctly decoding the nystagmus using Dr. Danesh's strict criteria, doctors aren't just taking wild guesses here, they know exactly which canal holds the debris. And this knowledge allows them to perform incredibly precise physical repositioning maneuvers. Essentially, they tilt the patient's head in very specific angles to physically flush those rogue rocks right out of the sensitive canals. This clears the debris, completely eliminates the positioning nystagmus, and ultimately cures the vertigo. Which brings us to a final thought I want to leave you with today. We've just seen how microscopic rocks can totally tilt our world, and how involuntary eye twitches provide a literal map to cure it. So, if our eyes can reveal the hidden microscopic secrets of our inner ears, what else is the human body trying to tell us? It really makes you appreciate the intricate, interconnected alarm systems within all of us. Thank you for joining me for this explainer, and remember, keep looking for the signals.